Hello guys, welcome to my channel Twastramanas.
In this video we are going to see the other 6 types of counseling. 7. Mental health. 8. Child and adolescent counseling. 9. Grief counseling. 10. Trauma counseling. 11. School counseling and 12. Crisis counseling. Understanding grief counseling. Grief counseling is a form of therapy designed to help individuals cope with the emotional, physical, and psychological effects of losing a loved one. The process of grieving can be overwhelming, and without proper support, it can lead to prolonged distress and other mental health issues. Grief counseling provides a structured environment where individuals can express their emotions, process their loss, and find ways to move forward. This comprehensive guide will explore the stages of grief, various models and tools of counseling, and provide detailed examples to illustrate how these concepts are applied in practice. The stages of grief. The stages of grief were first introduced by Elizabeth Kubler-Ross in her 1969 book, On Death and Dying. These stages provide a framework for understanding the grieving process. It is important to note that not everyone experiences all stages, nor do they occur in a linear fashion. The 5 stages are 1. Denial. This initial stage involves shock and disbelief. The individual might think, this can't be happening to me. Example. After losing a spouse, a person might continue to set a place at the dinner table for them, unable to accept their absence. 2. Anger. As the reality of the loss sets in, anger may surface. The individual might feel frustrated and helpless, directing their anger at themselves, others, or the deceased. Example. A bereaved parent might feel intense anger towards medical staff, believing they didn't do enough to save their child. 3. Bargaining. During this stage, individuals often make bargains with a higher power, hoping to reverse or delay the loss. They might dwell on, what if, or, if only, statements. Example. Someone might pray for a deceased loved one to come back, promising to live a better life in exchange. 4. Depression. Profound sadness and despair characterize this stage. The individual might withdraw from life, feeling that it is no longer worth living. Example. After losing a job due to illness, a person might lose interest in activities they once enjoyed, feeling hopeless about the future. 5. Acceptance. This final stage involves coming to terms with the loss. The individual begins to find a way to move forward, though the pain may still be present. Example. A widow might start to participate in social activities again, finding joy in life while still cherishing memories of their spouse. Models of grief counseling. Several models have been developed to understand and facilitate the grieving process. Here, we will explore 3 prominent models: Warden's task model, the dual process model, and the meaning reconstruction model. Warden's task model. J. William Warden proposed 4 tasks of mourning that individuals need to work through to resolve their grief. 1. Accept the reality of the loss. This task involves recognizing and accepting that the loss has occurred. Example. A woman who has lost her father might visit his grave regularly to reinforce the reality of his passing. 2. Process the pain of grief. Allowing oneself to experience and express the pain associated with the loss is crucial. Example. A man might join a grief support group where he can openly share his feelings and memories of his deceased friend. 3. Adjust to a world without the deceased. This task requires adapting to the changes in one's environment and roles. Example. A mother who has lost her husband might learn to handle financial matters and household chores that her husband previously managed. 4. Find an enduring connection with the deceased while moving forward. Maintaining a connection to the deceased while continuing with life is important. Example. A daughter might keep a photo album of her mother and regularly share stories about her with her children, while still engaging in new activities and relationships. Dual process model. Developed by Margaret Strober and Henk Shah, the dual process model emphasizes oscillation between 2 types of stressor, loss-oriented and restoration-oriented. 1. Loss-oriented stressor. These involve dealing with the emotional aspects of the loss, such as sadness, yearning, and reminiscing. Example. A man might spend time looking at old photographs and crying, allowing himself to feel the pain of his wife's death. 2. Restoration-oriented stressor. These involve coping with the practical changes and new challenges that arise as a result of the loss. Example. A widow might take up new hobbies or re-enter the workforce to fill the void left by her husband's death. Oscillation between these stressors is a natural part of the grieving process, allowing the individual to manage grief while also adapting to life changes. Meaning reconstruction model. Robert Niemeyer's meaning reconstruction model focuses on the need for individuals to reconstruct a sense of meaning in their lives after loss. This model emphasizes narrative and the personal significance of the loss. 1. Sense-making. Individuals attempt to understand and make sense of the loss. Example: a bereaved person might seek therapy to explore the impact of their loved one's death on their beliefs and values. 2. Benefit finding. Identifying any positive aspects or growth resulting from the loss. Example: after losing a sibling to cancer, an individual might become an advocate for cancer research and find a sense of purpose in their advocacy work. 3. Identity reconstruction. Redefining oneself and one's life in the aftermath of the loss. Example: a person who has lost their partner might engage in new activities in social circles, gradually building a new sense of identity and self-worth. Tools and techniques in grief counseling. Grief counselors employ various tools and techniques to support individuals through their grieving process. These include cognitive behavioral therapy, CBT, narrative therapy, art therapy, and group therapy. Cognitive behavioral therapy, CBT. CBT helps individuals challenge and change unhelpful thoughts and behaviors associated with their grief. Techniques include cognitive restructuring, identifying and reframing negative thoughts. Example: a grieving person who feels guilty about their loved one's death might work with a therapist to challenge and reframe these thoughts, understanding that they are not responsible for the loss. Behavioral activation, encouraging engagement in meaningful activities. Example: a therapist might encourage a bereaved client to resume hobbies they once enjoyed or to volunteer, helping them reconnect with life and find new sources of joy. Narrative therapy. Narrative therapy involves exploring and reshaping the stories individuals tell about their loss. Techniques include externalization, separating the grief from the person's identity. Example: a therapist might help a client see grief as something they are experiencing, rather than as a defining part of themselves, allowing them to regain a sense of control. Reauthoring, creating new, empowering narratives. Example: a person might work with a therapist to rewrite their story, focusing on their resilience and the positive memories of their loved one, rather than solely on the pain of the loss. Art therapy. Art therapy allows individuals to express their grief creatively, which can be especially helpful for those who struggle to articulate their feelings verbally. Techniques include drawing and painting, using art to explore and express emotions. Example: a bereaved child might draw pictures of their deceased parent, using the artwork to convey feelings they find difficult to verbalize. Collage and sculpture, creating tangible representations of grief and memory. Example: a grieving person might create a collage of photographs, letters, and other mementos to honor and remember their loved one. Group therapy. Group therapy provides a supportive environment where individuals can share their experiences and learn from others who are also grieving. Benefits include peer support, sharing experiences with others who understand. Example: a support group for widows and widowers provides a space for members to discuss their feelings and offer mutual support and encouragement. Shared learning, gaining insights and coping strategies from group members. Example: in a group setting, a bereaved person might learn new ways of coping with holidays and anniversaries from others who have faced similar challenges. Conclusion: grief counseling is a vital process that helps individuals navigate the complex emotions and changes that accompany the loss of a loved one. By understanding the stages of grief, utilizing various models and tools, and applying practical examples, grief counselors can provide effective support and facilitate healing. Through compassionate guidance and evidence-based techniques, individuals can find a path to recovery and learn to live with their loss in a meaningful way. Trauma counseling. Comprehensive overview. Trauma counseling is a specialized area of mental health counseling focused on helping individuals recover from traumatic experiences. These experiences can range from single incidents, such as accidents or assaults, to prolonged exposure to stress, such as ongoing abuse or living in a war zone. Trauma counseling involves several stages, models, and tools designed to support the healing process. This comprehensive overview will delve into each aspect, providing detailed explanations and relevant examples. Stages of trauma counseling. 1. Establishing safety. Description. The primary focus is to create a sense of safety for the client. This includes physical safety, emotional stability, and establishing a trusting relationship between the client and counselor. Example: a counselor working with a survivor of domestic abuse might spend several sessions ensuring the client feels secure enough to discuss their experiences. This could involve working with local shelters to ensure the client is in a safe environment. 2. Remembrance and mourning. Description. This stage involves revisiting and processing the traumatic memories in a controlled and supportive environment. The client begins to confront and express feelings associated with the trauma. Example: a veteran with PTSD might use narrative therapy to recount their experiences during combat, with the counselor guiding them through the process and helping them manage intense emotions. 3. Reconnection and integration. Description. The final stage focuses on integrating the trauma into the client's life narrative and moving forward. It involves rebuilding a sense of self, relationships, and a new future. Example: a sexual assault survivor might work on developing new relationships and rebuilding trust in others, with the counselor facilitating activities and discussions that foster a positive outlook on life. Models of trauma counseling. 1. Cognitive behavioral therapy, CBT. Description. CBT focuses on identifying and changing negative thought patterns and behaviors. It is effective for trauma because it helps clients reframe their thoughts about the traumatic event and develop coping strategies. Example: a person who survived a car accident might have developed a fear of driving. Through CBT, they could challenge the belief that driving is inherently dangerous and practice exposure therapy to gradually become comfortable driving again. 2. Eye movement desensitization and reprocessing, EMDR. Description. EMDR involves the client recalling traumatic memories while the counselor guides them through bilateral stimulation, such as eye movements or tapping. This process helps reprocess the trauma and reduce its emotional impact. Example: a rape survivor might undergo EMDR sessions where they recall specific traumatic memories while following the counselor's hand movements, leading to a reduction in PTSD symptoms over time. 3. Psychodynamic therapy. Description. This model explores the unconscious processes and how past experiences shape current behavior and emotions. It aims to uncover unresolved conflicts from the trauma. Example: a client experiencing recurring nightmares after a traumatic event might explore their dreams in psychodynamic therapy to uncover underlying fears and anxieties, leading to a deeper understanding and resolution. 4. Somatic experiencing. Description. This model focuses on the body's responses to trauma and aims to release the physical tension stored in the body. It emphasizes awareness of bodily sensations to process trauma. Example: a person who experienced childhood abuse might work with a counselor to become aware of and release chronic muscle tension through body-focused techniques like breathing exercises and mindful movement. Case study. A comprehensive example. Background: Sarah, a 32-year-old woman, was involved in a severe car accident a year ago. Since the accident, she has developed severe anxiety, nightmares, and a fear of driving. She sought trauma counseling to address these issues. Stage 1. Establishing safety. Initial sessions. The counselor focuses on building trust and ensuring Sarah feels safe in the therapeutic environment. They discuss Sarah's current life situation and ensure she has a stable support system. Grounding techniques. Sarah learns grounding techniques to manage anxiety and panic attacks, such as deep breathing exercises and focusing on sensory experiences. Stage 2. Remembrance and mourning. Narrative therapy. Sarah begins to recount the details of the accident in a safe and controlled manner. The counselor helps her process the emotions associated with these memories. EMDR sessions. Sarah participates in EMDR, recalling specific traumatic moments from the accident while following the counselor's finger movements. Over several sessions, she experiences a reduction in the intensity of her emotional responses. Stage 3. Reconnection and integration. Cognitive restructuring. Using CBT, Sarah works on challenging and reframing her negative thoughts about driving and her overall sense of safety. Exposure therapy. Sarah gradually begins to face her fear of driving. Initially, she practices sitting in a stationary car, then progresses to short drives with the counselor's support. Future planning. Sarah and the counselor discuss her goals and aspirations, focusing on rebuilding her confidence and envisioning a future where the trauma does not control her life. Outcome. Over the course of a year, Sarah makes significant progress. She no longer experiences severe anxiety or nightmares, and she has regained confidence in her ability to drive. The trauma is integrated into her life story as a challenging experience she overcame, rather than a defining moment that controls her present and future. Conclusion. Trauma counseling is a multifaceted and deeply personal process that requires tailored approaches to meet each individual's unique needs. By understanding and applying various stages, models, and tools of trauma counseling, mental health professionals can effectively guide clients through their healing journeys. This comprehensive approach ensures that clients like Sarah can move from a place of fear and pain to one of strength and resilience, ultimately leading to a healthier and more fulfilling life.
Thank you for your time, and I hope you liked the video. Please share, subscribe, and like the video. It will give me motivation to create more contents like this and to help you help your loved ones. Stay tuned for more.